Good morning everybody. Today we are going to talk about how to improve the egg quality in IVF. As you all know, in IVF some patients, when we retrieve the eggs, they give a little poor quality of eggs, and then when we inform to them that your success may not be good because of the quality of the egg is very poor, then they frequently ask, how do I improve the quality? So friends, in IVF, what is IVF? IVF means we need one very healthy egg and one sperm which should be normal. So when we fertilize that in the laboratory, we get a healthy embryo, and when we transfer that, it results in a healthy delivery of the healthy baby. So to improve the egg quality, the most important thing what we can do is, before we start IVF, we have to we have to do all the investigations and check if the patient has any hormonal disturbances. Because see, hormonal disturbances is the commonest cause for abnormal structure of the eggs or the poor quality of the eggs, like in polycystic ovaries, wherein they have high level of androgens, and that causes a premature premature stoppage of the growth of the follicle and even the abnormal follicle, and mitochondrial degeneration and all that. So to correct the disturbances is very important, and the second most important thing is the thyroid should be under control. So for all these patients, we do basically the investigations to find out if there is any problem, and then a strict control of the diabetes. So these three things are very important to correct the hormonal disturbances. And then on the next, which is most important, is the age of the patient. As we all know, young patients, they produce best quality of the eggs, and as the age advances, like after say 35 years, the quality as well as the quantity, both they come down drastically. So we advise all our patients to finish their family at least before 30 years, and if not 30, at least before 35 years, because after 35 there is a sharp fall in the fertility because of the poor quality of the eggs, mostly because of the structural defects or even the mitochondrial defects. And then the third thing which is very important is a lifestyle. So nowadays, as you know, mostly because of the sedentary job or because of the junk food and then the smoking and then the alcohol, all these things, they affect the quality very badly. So when once a patient decides to undergo IVF procedure, we ask them to stop it completely, at least for 3 months. So it takes about regeneration for about 3 months. The follicles are recruited 3 months before, and by the time they come, by the time they are visible on the scan, it takes about 3 months. So they should improve their lifestyle. And then the fourth, which is most important, is the body mass index. As we know, as a patient becomes obese, you need to give very high dose of gonadotropins, and then even the quality of the egg suffers, and there is a lot of fat deposition in the egg, and that spoils the quality of the egg. And not even quality, but even the implantation rate is also reduced. So most important is to keep the body mass index around 25 or between 25 to 30, not more than that. If the patient has more than that, then we advise them to go for weight loss and then try the procedure of IVF. So once the patient has corrected all this, then the next, which is very important, is like nowadays the patients, they are postponing their childbearing because of the career pressure. So these patients, we have a very good option called fertility preservation. So what we do, if suppose she doesn't want to have a baby for the next 3-4 years, but she is around 33, 34, 35, and she is worried that her ovarian reserve might come down. So these patients, what we do the ovum pickup, and we fertilize the eggs with the sperm, and then we freeze these embryos. That gives very good results. So whenever she wants to have a baby, she can have. So this is one very important tip which we can share with the patient, and we can inform them. And then the next, which is very important, is the supplementation. So as the woman ages, or even for the young patients, if they have any deficiency of vitamins, most important is vitamin D, then calcium, and then iron, and they should take, so these things should be corrected. And we should advise a patient to go for colored fruits, colored vegetables, because they are rich in antioxidants. And we have to give them some supplements like CoQ and vitamin C, and then we have to give them vitamin D. And elderly patients, we put them on testosterone gel or testosterone oral tablets like DHEA tablets. So with all these measures, definitely the egg quality improves, but it takes about 3 months time. That the patient has to understand. It doesn't happen overnight. So they should, we should start the process 3 months before they are planning for IVF. And then last but not the least is the best quality of the injections when we do stimulation of these patients. they should be from the best company, and the cold chain should be maintained, and they should come and take in the, better is to take in the premises, not at home, so that where the 24 hours temperature is maintained. So when the patient takes care of all these things, definitely the egg quality improves, and once we get a good quality of egg, we'll get good quality embryo, and the success can be improved tremendously. So thank you very much.